Welcome to the City Current Show, powered by Higginbotham Insurance and Financial Services.
This show focuses on sharing good news and powering the good in our community. Now here's your host, City Current CEO, Jeremy Park.
Welcome back to the City Current Show, powered by Higginbotham. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And in this case, we're talking about Nurture the Next. We're honored to be with Jennifer Vaida, Chief Strategy Officer with Nurture the Next. How are you doing?
Doing great. How are you doing?
Doing very well. And so when you talk about Nurture the Next, that kind of gives us a little bit of an illustration in terms of kids and parents and making sure they're well equipped for success. And so there's a lot to unpack, including a big anniversary. So let's start with a little bit of history and some context. Give us some history for Nurture the Next.
Great. So we have been around since 1983-84, when we started out as a very small group of parents, parent volunteers supporting each other, supporting their communities, called Parents Anonymous. And it's been a trajectory of growth ever since. We became the statewide chapter of Prevent Child Abuse America. So even though we had a name change a while back from Prevent Child Abuse Tennessee to Nurture the Next, we are still the statewide chapter of Prevent Child Abuse America. We are solely, through that affiliation, aimed at child abuse, neglect, and prevention. At Nurture the Next, our mission is even broader. We want to take it beyond just preventing abuse and neglect, and we want to take it to that level, that upstream level, even further up the ladder, where we are setting children up to thrive. And we do that by supporting parents in the homes with their children, supporting other folks that interact with children, live in community with children, public-private partnerships that understand how important this is for healthy futures. So when we're nurturing the next, we are nurturing the next generation and the generation after that. And yes, we are celebrating our 40th anniversary this year, and we are very excited. Our campaign is around raising the next. So we are raising the next generation again and the generation after that. So it's a celebration and a forward thinking, progressive idea of strategies, of ways that we can help improve the climate and culture for children and families, and really every citizen in Tennessee, because when kids and families are healthy, everybody benefits.
So you kind of alluded to a lot that we'll unpack. Let's start, though, with a little bit of context around where we are with the state of Tennessee. What are some of the stats that are challenging, perhaps alarming, but also too optimistic, for where things are headed? Give us some of the stats that kind of stand out on your end when you talk about the things that you all are focused on and just kind of where we are in society and, some of the things that you're tackling. What are some of those stats look like?
First of all, I love how you phrase the question, because you look at, and that is actually what we do when we're working in homes with families and working with partners, is you look at challenges as opportunities for growth. Things can be fixed, things can get better. We know through the science around hope that hope is essential for health and success and betterment at every level, from the individual to, society. So I love that you phrased it like that. Absolutely. I think in order to start to mine for and implement solutions, including programs, financial supports and allocations, awareness building, education, we have to know where we stand. We have to know what we're dealing with. And there's a lot of complex systems that come into play when it comes to things like this. There's never a single source, right? It's individual at so many levels. There are some common threads of things that can be done that will improve all of the things, but it's complex. Just like when we're working with families, we have a program, but every family is different and individual, and they have their own history and their own dynamic and their own values. And so we, want to meet folks where they're at. Every year, the Tennessee Commission on Children and Youth shares a report, kind of the state of the child. And it's really important to collect this data and to report on it, make it available, because we need to see where we are. And when we are able to look at a report and say, okay, these are areas in which we have made dramatic improvements, and there are areas in which we have made dramatic improvements. These are areas that continue to be areas of concern. They're serious. Things like child poverty rates, right? One in 5 children in Tennessee lives in poverty. That's a really high rate. And it does ebb and flow, but it's pretty consistent that a lot of children are living in poverty. And we know that when basic needs are not met, food, security, healthcare, it is hard for the brain to develop in a way that is going to set a child up for long-term success. Particularly critical are those first 5 years. So birth to 5, which is really where our mission is primarily focused, because we know the earlier you get in, the better the interventions and the better the outcomes. We really, really need to be looking at that and figuring out how we can invest in multiple ways through various resources and making sure that these kids are healthy those first 5 years. So there is some of the stats that we have seen that are things that we need to look at are collected through various sources. You know, they come from the Department of Health, or they come from the Department of Children's Services. We look at things like hospitalization rates, but preterm births are up pretty significantly in the state. Our rate of unintentional infant death due to suffocation has nearly doubled since 2018 and is the second highest in the nation. And again, hearkening back to what you said earlier about that sort of optimistic look, is that there are very real, tangible things that can be done to reduce that significantly with a little bit of education. And that's sounds like a little bit of education. Just, put out an ad, put something on someone's like social media feed, it'll be fine. But little bit of information is actually really hard to spread in large swaths of people in large numbers. It almost has to become something that is like talked about consistently in some way. It's almost like you can recall it from memory, like, oh, safe sleep. What does that look like? What are the things that reduce the possibility that, I could particularly be harming my infant or the infant that I'm taking care of? And there are all kinds of things, materials, books, acronyms, phrases that have been developed around kind of increasing this education. So the question to us is, what can we do? Why are those numbers, trying to get some idea about why are those numbers so high now? What has something changed? Looking at, really evaluating, striating the data and figuring out, okay, this is why. But also saying, okay, well, we need to ramp up our efforts. So nonprofits like ours, when we're evaluating what our priority areas are, what our strategies are, when we're working and doing training with our family support specialists that work directly in home with families or out there talking to all of our partners, we want to say, hey, let's try to incorporate something related to safe sleep or related to this particular safety issue, or related to nutrition or access to food services or whatever it is. And again, you have to hear something multiple times for it really to sink in. That's what these reports do, right? When we see things like less than half of the students in this state are proficient in language arts and math, right? Again, what is it? Is it more than before? And it's really hard to look at data, as you probably know, year over year. Looking at it from one year to the next isn't really evocative of like trends that are long-term. But when you're looking at cycles of data and you're looking at either like, fluctuations or decreases and then suddenly an increase, we could see that after the pandemic. We could see that there were steep increases or increases depending on the domain, but there was something very specific that we could point to for that. It was a very specific public health emergency, which changed the way that we all were living and functioning in society. So you can break that down if you're a researcher, it gets really interesting and see what is it exactly that. But for us, we just know, okay, a lot of these things are probably very heavily dependent on on an isolated, they'll probably at some point be repeated event. And then we can take lessons from that. So the researchers are the one that say, okay, if we ever find ourselves in this situation again, this is what caused these poor health outcomes in this area. This is what caused, reading or like things like literacy rates or whatever to go down during that time. These are things that we need to think about and be better prepared. Because when you know better, you do better. I know that's an adage that people use all the time, but you really hope that that's true. And society is always changing. Access to things is always changing. Our education is always changing. We always have to be willing to learn and grow and evaluate. Something that we may have been doing for 20 years and has worked gangbusters, suddenly it just doesn't work anymore. And you have to think about why and how to all work towards that common goal. Regardless of, we get tripped up, I think, sometimes in language or the posturing of things, or can't always agree on like how exactly to get there. But most of the time, the common denominator that you're going to find, if you're talking to your neighbors, no matter their backgrounds, no matter their affiliations, if you're talking to your coworkers, if you're talking to most people, they're going to agree that children should be safe. Children should be free from abuse. Children should not go to bed hungry. Children should have access to things that is going to enable them to be successful adults and contributors in our society, because we live in community with them. These children are going to be our future doctors, our future teachers, our future researchers, our future, childcare workers, our future like neighbors, our future friends, maybe spouse. These are the people that we're going to live with. And that if we have children, our children are going to really kind of move through the world with that. And so really, we are able to, through a variety of, luckily, because we have such a great organization with such a varied workforce and so many specialties. And we also are supported through many wonderful, generous donors, foundations. We get state support. We are able to look at these things and not really get caught up in the, well, I'm upset and I feel hopeless. It's more about we need to be aware of these things. We need to educate people. We need to think about ways to advocate. We need to empower parents. We need to know that they're the experts. We need to work with 2 generations at a time, parent and child. And there are things that we can do. Our programs, our evidence-based programs, have long-term longitudinal data that if we are trained appropriately, have the resources, and implement the program the way that it is intended, that we are going to see increased outcomes in so many domains that is essential and really foundational to a lifelong trajectory of health, wellness, safety, and really taking it beyond to like that thriving place where that's what you want for all kids.
Let's go ahead and dive into the programs, because you're obviously painting the picture on everything that you do and the reason it's so important. So share maybe, when you talk about all the different programs, as you alluded to in the beginning, you do a lot, but let's go ahead and, highlight a few major ones, especially going into the home. So go ahead and give us some of the highlights for your programs.
Starting obviously with our largest program, the one we've had the longest. We're in over 30 counties in Tennessee with our direct service programs, but we also are statewide for education and advocacy. That is a 5-year program that we have. So a mom can enroll as soon as she finds out she's pregnant and at any point during pregnancy up to when the child turns 3 months. So there is a very specific foundational curriculum that then grows as the child grows and as the parents' awareness and understanding grows, and the dosage and the frequency gets less as the child gets nearer to graduating from the program or like entering school. So entering like kindergarten or pre-K. It starts out with a weekly visit with families where they meet for at least an hour, and they start out sort of looking at what are the What are the things that you want for your child? What are the things here that you really feel like you have, like, are working, that you feel confident about? What are the things that you need? What are there pieces of your experiences in childhood or your situation that you want to share that can help inform the resources and all of that? So it's very relationship based in that aspect. Our family support specialists in our Healthy Families program go through intense training, not only on the pieces of the curriculum, so things like what percentage of a baby's brain is developed by their 3, and what do things like serve and return mean, and how important it is to like bond and interact, and how do you build those things, actually activities that is not jargon academia that we're going to learn in like a child development class and, you know, freshman year in college. Like, this is like, we're going to talk to the parent. We're going to talk in the language that the parent understands and present the information in a way that's going to resonate with that parent. And then that relationship, as that relationship deepens and the trust deepens, right? There is a partnership, like a beautiful side-by-side partnership of a family support specialist and a family that trusts that that family support specialist is there to support them, to be their cheerleader, to empower them, to really cultivate self-sufficiency, right? It's not about going in and telling people what to do, what they need to do. Oh, if you just did this, all of your troubles would go away, or that wouldn't be an issue. That's not the role of family support specialists. That's not the role of our agency. The role of our agency is to empower parents with the tools and help them discover the strengths in themselves that can problem solve and support them along that journey. So it is our biggest program is Healthy Families America. Like I said, we are in multiple counties. We have been doing it for a long time. Our family support specialists undergo weeks of intense training to just prepare not only the curriculum piece, but also the relationship building piece. Really hard to build a relationship and trust with someone that quickly. And that's the magic that happens. But it also, you know, your people are inviting you into their home. These are folks that probably in their lifetimes have not had the best experiences with things that they deem to be punitive, or services that, you know, they haven't had positive interactions with before for whatever reason. And so they're inviting us and their family support specialists into their homes, and we have to honor that. We have to respect it. If a family doesn't speak English, we have interpreters that come and interpret the visits, because we want for that family to receive the best services possible and have that equity, right? Of like, these shouldn't be barriers. So Healthy Families, we love it. We've been doing it a long time. We believe in evidence-based home visiting. We know that the outcomes work. And that's probably our single largest program, and the longest term program. We have parenting, sort of group parenting classes called Nurturing Parenting Program. Those are much shorter term programs. They're usually about 5 to 6 weeks. And in each class, there is a construct that is covered. And by construct, I mean, what are the 5 elements from like attitude, behavior, and beliefs that can either protect, positively nurture, or negatively nurture, be abusive? And what are those things, and how do we look at that in our practices and what we understand to be true about child development? And how important is it that I actually know that just because my baby maybe is not going to be able to recall an experience that she has when she's 20 months old, that doesn't mean that there is no impact from that, because that's not how human beings develop. We know that. And so when we're able to like educate and and teach those things and have parents engage and come through those discoveries, they understand the implications of the environments and behaviors. Unlike healthy families, unlike evidence-based home visiting, nurturing parenting in the way that we do it is a very short-term prevention program. So in that case, there is no expected like behavioral change, because behavioral change takes a long time. That's why these programs are long, to some 2, 3, 4, 5 years. It's like, I'm sure you've heard, like, there's always, how long does it take to develop a habit, right? Like, you have to first learn something, hear it probably like 20 times, deal with the cognitive dissonance or whatever that's like challenging everything that you always knew. Like, I don't know, my grandma always said it was fine to put honey in the bottle. No, botulism, don't do that. Like, your brain has to like accept that. And then you need to take steps towards like modifying behaviors. Again, I want to take a moment to mention here that it's really important to understand that while parents are foundational to lifelong like health and success of their children, they do not operate in a vacuum. Parents are very, very impacted by, and their children, by the communities in which they live, the resources available, access to all of the things, fresh foods, medical care, schools, all of those things for their children, parks, open spaces, safety. A parent can control what's in the home, but they can't control what happens outside, and you have to go outside. We know that. It's important for children to thrive and live in community and have that socialization. So I just want to take a moment. I'm really focusing a lot on like the parent and the child in the home. And I think it's a really important point to realize that that's why we talk about these things, and we talk about education and advocacy. And why we always say, you know, even if you don't have a child yourself, you don't want to have children, you probably love a child, know a child, or you at least very definitely live in a community where children live and grow. So it's kind of relevant to everyone. It's sort of that's my little pitch when I throw it out there. I'm like, I know you probably don't care about this, but like, listen, this is why you should care and why it's important. So, circling back to nurturing parenting, essentially what we're really looking to do and what we measure. So again, we get investments from the state and we get investments from partners, not only because they believe in the mission and the vision, but also because we can prove through the collection of data and reporting that it works. The outcomes that we're tracking are a lot. There's a lot, not only in terms of like, how did the parent feel about it? You know, how was the relationship, but also like this tool that we did to measure development in a child's, 6 to 12 months, they're like meeting the markers. Or after 2 years in evidence-based home visiting programs, 98% of parents that engaged have no substantiated cases of child abuse. Like, we can correlate the data because we collect it. So it's remarkably efficient, and a lot of work goes. It's not as much as our family support specialists, I'm sure, would just like, can I just work with families? I don't ever want a paper. I don't ever want a tool. It's really important to be able to demonstrate that to continue to get the support that we need. So in nurturing parenting, really what we're measuring, though, is we're measuring shift in attitude. A shift in attitude is the precursor to behavioral change. You have to believe in something and believe that it's going to work and believe that it's going to benefit you and believe that you can do it before you're going to consider shifting whatever is happening. And that process in and of itself sometimes takes years, but really the goals of that are really that sort of attitude shift that's a precursor to behavior, and it gives one of the protective factors for families, which is the ability to like socially engage with other families and other parents. You sort of being in the world space, covering all the events, hearing all the things, have probably heard multiple times about the epidemic of loneliness, how like lack of socialization and lack of community and lack of feeling like other people can relate to you or understand even a little bit of what you're going through is so incredibly devastating and like harmful, not only psychologically and emotionally, but also physically. Our bodies will break down. We know that babies without love and care, not food, not any of those things, love and care, experience something called failure to thrive. They literally do not grow at the rate that they should be growing, which just goes to show how incredible human beings are, but how absolutely pivotal it is to live in community and know that we're supported by those around us. The last thing that I'll talk about is our work around parent advocacy and parent engagement. So there is no better voice and no truer voice and no voice more capable of being catalysts for change than parents. Parents in our programs, parents that have engaged in our programs, have engaged in other social services. Parents are the backbone. And so our responsibility is to give them the tools and champion them to feel confident and equipped to raise their voices for a rallying cry when they need to improve the communities in which they live. So they have that sense of autonomy, actively engaging in making a difference rather than being in that sort of victimization piece, but they're also provided the resources and the support, and they're able to decide if that's how they wish to engage. So we are the backbone agency for the Tennessee Parent Leadership Collaborative. And those are parents from across the state, all 95 counties that have either participated or are currently participating or have volunteered with agencies, social services agencies that operated on our statewide board to kind of recruit other parents, encourage other parents, sit on governor's task forces, sit on national parent boards, really be those champions for change. So we're the backbone agency for that. And then we engage our own like parent advocacy groups and things like how are parents, do they feel like our curriculum is working for them? Do they feel like it's culturally sophisticated? Do they feel like they are getting the respect and they're being heard? Those things matter. And so you elevate the parent voices. If you're not incorporating feedback from the participants and the folks that engage with you, whether it's your communications and stuff you post on social media, what your trainings look like, how you're operating in the home, what your brand awareness and like feeling is out there in the community, if you're not gathering that feedback and doing something with it to improve, then I think that's definitely an opportunity for growth. So our parent advocacy and education really allows us to formalize that in a way that we can measure and like tweak so that it works. We know that we can say, I promise you this is not a waste of your time. I promise you that you are not spinning your wheels for nothing. I promise you that this is going to be good. So those are our biggest, I think. There's a lot of other things I could go through, but this is like a brief show, so I'll spare you, but that's kind of the highlights.
Well, let's wrap up with how can the community get involved? Obviously, the 40th anniversary, there's all sorts of celebrations around that, but ways to get involved and engage. So talk about how the community can support your efforts, and then we'll wrap up with where to go to plug in.
I love it. Yes. So obviously, we would love for you, I think the easiest, quickest way to hear about us, engage with us, is to follow us on our socials. Like it's Nurture the Next. Follow us and you can see our updates. There's opportunities to sign up for our bulletins and newsletters. We are celebrating a birthday this year. So we're going to have a big event. We are going to have various opportunities for our volunteers and supporters to engage with us. We're launching, I'm so excited about this. We are launching our first named annual fund and our first giving society. And so we are looking to have that 40 for 40 class of our like giving circle folks. And we're looking for individual donors, no matter how big or how small, like investments. It really has a ripple effect that raises the tide in this state. And you can feel like you're really doing something. And I will tell you that one of a real quick important thing about engaging with us is that the urgency around the work that we do and like other prevention services do in early childhood isn't always felt. It's not always palpable, because a lot of the words and the imagery and things that we see is very cute, very like, oh, they're so precious and like giggling and stuff. That's great and that's important. But what's really important is to realize that the first 5 years are so foundational to the trajectory of a child's life that it's brief, it's ephemeral in time. So when we talk about like investing now, investing in the next now, we're talking about there's an urgency around it because we have kids that continue to, and then kids are born every day, and then they start that cycle of that 5 years. So we also are looking for volunteers to engage with us. We do parent events where all of the parents in our programs get to come in and celebrate something, whether it's, around the holiday season or end of year, and engage with each other. So we're always looking for events, activities, folks to do things like that. We love to have folks that might have specific talents like writing, or if there's any mommy bloggers, influencers out there, Nurture the Next would love to talk to you because they've got a large platform and we would love to engage with those folks. So call me. But lots of ways to engage. And again, there's information on our website and on our socials, and that'll kind of cue you into everything. But this is a big year for us. This is 40 forward. This is raising the next generation. We're really proud of where we come, how far we've come, and we're really excited, not only excited, but hopeful and energized around the next 40. So I'm so grateful that you allowed us to talk to your audiences today and share a message that's really important to us. And we're just really grateful. Thank you. And thank you to all the Tennesseans and others out there that are being champions for children and families. Really appreciate you.
Well, make sure everyone, the website is nurturethenext.org. So nurturethenext.org is where to go to learn more and get involved. But Jennifer, thank you for all you and your amazing team do. Thank you for coming on the show.
It's been a pleasure. Thank you so much.
Higginbotham Insurance and Financial Services is proud to power the City Current Show. We're a people-first company that protects what matters most, the families, businesses, and trailblazers that keep our community going. As one of the nation's top independent insurance firms, Higginbotham is a single-source solution for business insurance, employee benefits, HR services, and personal insurance that's customized for you. We're here to serve you, the people you care about, and your community. Call 866-377-1959 or visit higginbotham.com.